my IV medication video. Today we're going to be giving a IV push med and an IV piggyback med. So first off, I gather my equipment. I'm going to check my order, which I have pulled up right here. We're going to be giving lorazepam IV push, 2 milligrams, and that's PRN for anxiety or agitation. And then the patient already has normal saline running at 100 milliliters an hour. And then we're going to also be hanging cefalozolin sodium. And we're going to be giving that 1 gram IV piggyback, and that's going to be able to run with the normal saline. Okay, so before I would begin doing my medication, I would check the record, which I also have pulled up here, for any allergies to make sure the patient isn't allergic to either medication. And I see that they are not. I would check my drug guide to see how the medication should be prepared and make sure that there are no contraindications and that the order dose is safe. I would make sure I knew what the dose was for and make sure that I have clarified the order. So before I begin, I'm going to wash my hands. And make sure that I prepare the medication for one patient at a time. Okay, so first I'm going to read the MAR, and first we'll do the IV push med. So I see lorazepam, 2 milligrams. This is lorazepam, 2 milligrams. I'm going to compare it. This is my second check with the MAR. And then I also have my diluent. And I know that because I've done my math, that the order is 2 milligrams, and I'm going to draw up 1 milliliter of the medication because it's 2 milligrams per milliliter, and then I'm going to draw up 1 milliliter of the diluent for a total of 2 milliliters. I've also done my math. The total time, I'm going to give it 2 milliliters over 60 seconds, and I'm going to give 0.5 of a milliliter every 15 seconds. Okay. So, it's my medication. Uncap my syringe. And draw back 1 milliliter of air. Before I would have done that, I would have wiped off the top of the vial with an alcohol swab for 30 seconds. I'll draw back 1 milliliter of the medication. Okay. And then I can safety my needle. And this can go in my sharps container. We're going to set this to the side. I'll set my medication right here. I'm going to clean off the top of my diluent. Draw back 1 milliliter of air. And like I said, I would have cleaned this for 30 seconds and then allowed it to dry. Insert the air. Then I'm going to draw back 1 milliliter of the diluent. Take this. And then now at this time, I'm going to insert my diluent into my syringe with my medication. And be careful not to touch the needle to the medication. Okay. Now I can safety this. This can go in my sharps container. I'm going to check, make sure I do have 2 milliliters, which I do. Then I'm going to take my red cap. this on top. I would label this with my initials, the date and the time, and what medication it is, and for what patient it is for. And then I'm gonna set this with my vial, with my vial of medication right there. Okay, so next I'm going to prepare the piggyback med. So I have this, I have my med, which I've already uncapped, and I have some alcohol swabs, and I have an adapter. Start off with, I will wipe the top of this for 30 seconds. And once again, just like with the push med, I would have compared this to the MAR, made sure it was what was ordered, 1 gram, and I would perform my first and second check. So wipe the top of this for 30 seconds, let it air dry, pop this. Okay. I'm gonna let that sit there. Pop this off, and then take another alcohol swab. Clean this for 30 seconds. And I would allow it to air dry. Now I can attach my medication to the back. There we go. Okay. So now squeeze my bag so that the vial. Okay, so I would fill my vial up with the liquid and then shake so that all the medication is dissolved. There's a little bit more in there. So now we're going to drain the medicine back into the bag. Okay. Yep. There it is. Okay. So now we have our IV piggyback medicine ready. I would take a label and label this with the patient's name, my initials, the date and time that it was prepared, and what medication it is. So now we are ready to go to the patient's room. I would make sure to lock up all the medications before I left. All right, here we go. So I would knock. Hello, Mr. Brown. My name is Casey, and I'm a nurse. And I'm going to be giving you your medications. I'm going to wash my hands. Can you tell me your name and date of birth? And he does. And then I'm going to ask, do you have any allergies, Mr. Brown? And he tells me he has no allergies. I would have my computer pulled up so that I could check that up against his record. Mr. Brown, today I'm going to be giving you your lorazepam, and that is going to be given IV push through your IV system. I'm also going to be hanging an antibiotic up with your other IV solution so that you can get that. It'll take about several minutes, 5 to 10 minutes. Do you have any questions before we begin? And he says no. I'm going to put on clean gloves. And before I begin to do anything, I'm going to check, make sure this is running at the correct rate. And then I'm going to assess his IV site. I'm checking to see for any signs of phlebitis or infiltration, so redness, swelling, any like coolness or anything like that around the site. His site looks good. So we're going to give the IV push medicine first. I have 2 salines, and I also have several alcohol swabs. We're going to go to the port closest to the patient. To start with, before I give the medicine, I'm going to do my 3rd check. So I've identified my patient. I know that this is the correct patient. I have his record pulled up on my computer screen. I identify once again that this is lorazepam 2 milligrams and that I'm giving it IV push PRN for anxiety or agitation. And I know that I'm giving it 0.5 milliliter every 15 seconds, and there are 2 milliliters in this vial. I'm going to take my scanner and I would scan his armband, which is right here. I would also scan the lorazepam, and I would verify the med, the patient, the date, the time, and the right reason for giving in the computer. Okay, we're going to go to the site closest to his IV. I'm going to start by cleaning off the site with an alcohol swab for 30 seconds. And then I'm going to let that air dry. I'm going to take my first flush, pull back, and I would give this 10 milliliter flush over 1 minute. So I'm going to unclamp his IV, insert this. On my watch for 1 minute. And I would also make sure that the patient was at my waist height, even though we can't really do that now. Okay. I'm going to take this off. This can go in my sharps container. Now I am prepared to give my medication. Okay, 0.5 milliliter every 15 seconds. Okay. Alright, this can go in my sharps container. I'm going to take another alcohol swab and clean out the port just to make sure there's no medication left on the port. I'm going to get my other saline flush. I can open it. And this time, instead of giving it over 1 minute, I'm going to give this at the same rate that I gave the medication, just to make sure that any medication that's still in the line is flushed through at the correct rate. So half a milliliter every 15 seconds. Okay. This can go in my sharps container. Now I can take a new clean red cap and put that on the end. Well, actually, I would wipe it with an alcohol swab first before I put the red cap on. Wipe that with the alcohol swab and then put this red cap on. Okay. Now I would have to stay with my patient for several minutes just to make sure he didn't develop any adverse reaction to the drug, and to make sure that it was infusing through the IV correctly. Put this in the trash. I'm going to wash my hands again. Now we are ready to hang the IV piggyback. So, have my piggyback drug here. It's all in the mini bag. I'm gonna lay that right there. This is my secondary IV set. As I said before, this drug can run at the same rate that the normal saline is, right? Okay, so I want to connect this to a port that's hanging above the IV pump. So I'm going to go for this port right here. Take my bag. This off. And I'm going to go ahead and spike my bag, make sure everything remains sterile. As with the IV push medicine, I would once again check that he did not have any allergies. I have his medical record pulled up here. I would verify that this is the correct drug that is given for the correct reason. This is the correct patient, correct date and time, and that this is the correct dosage. I would take my scanner and I would scan his armband, and I would also scan the drug and verify it all in the computer. Okay. I'm going to fill this up 1/3 to 2/3 full, depending on policy. Okay. And now I'm going to connect this to the line, and this is called back priming. So when I connect it to the line, the force of the saline running through will prime this line. So I'm going to scrub this connector for 30 seconds and allow it to dry. making sure that everything remains sterile. I'm going to connect this to the line. Sure all my clamps are open. And yeah, make sure everything's open. I'm going to open up this. Okay, that allows the line to fill. And then now I can hit pause on my pump, and I'm going to go ahead and clamp this back. So now I'm ready to hang my medication. The bag of saline has to hang at a level lower than the piggyback med. So hang that back. Okay, I would ensure that everything's running correctly, and I would hit start again on the IV pump. I would stay with my patient for a couple of seconds just to make sure that the medication is running through the IV correctly. I see that it is. I would ask him before I leave the 4-piece. So, Mr. Brown, do you need to go to the bathroom before I leave? He says he does not. I would ask him, are you in any pain right now? He says he is not. I would make sure he's in a comfortable position, and I would make sure that everything he needs, his call bell is in close proximity to him. I make sure the bed is in the lowest position. I'm going to wash my hands. And I would open my curtain, and I'm done with this skill.